Guys, I hope everybody had a great weekend. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to talk about back pain that's radiating down to your hip, all right? Or back pain that you feel initially in your back and it moves to your hip, or back pain that you're feeling initially in your back and it's now you're not only feeling it in your back, but you're also feeling it in your hip. This is a really common occurrence with back pain. Unfortunately, it doesn't always stay in one place. It would make everybody's job a lot easier if it did, but that is not usually how it happens. And unfortunately, the longer you ignore back pain, the more likely it is to spread to that hip area, that knee. You can get it all the way down the leg, into the calf, into the foot. So it is something that does happen, and it does happen sometimes immediately, but sometimes more after you ignore it for a while. Right. You can wind up having that hip pain that starts either here, or it's going to start over here and radiate down to here. It's really, it really is dependent on the cause. So let's talk about the cause of back pain. So there's a couple of reasons that you can have hip pain that or back pain that goes down into your hip. And it can stop at your hip. You may feel it going down your hip and down into your leg. The first one is a herniated disc. So a bulging disc, a herniated disc. That's usually found in an MRI. It usually comes up when you go on to see a doctor and they order some studies. It doesn't ever show up on an x-ray, but it does show up on an MRI. And what that is you'll start to feel maybe numbness and tingling going down your leg. You'll start to feel some type of sharp pain. Now, with the caveat of the herniated or bulging disc, 80% of Americans have herniated or bulging discs. So it's not something that if you go to the doctor and you get this MRI and you're like, oh, I have a herniated disc, that's why I have all this pain, that you can really write off right away. A lot of times what we see is there may be a herniated disc, but there also is muscle issues. There also is other things going on. So don't always automatically chalk it up to this herniated disc. It could be one of the reasons that there is radiating pain, but I think a lot of people are really quick to dismiss it because it is the thing that shows up on MRI, and it's very easy just to say, oh yeah, it's a herniated disc, that's why you have pain going down your leg. When in reality, we see a ton of patients who have pain going down their leg that starts at their back, and a lot of times, most of the time actually, it has nothing to do with the herniated disc. So while that could be the first cause, I'm already kind of debunking that cause, or just saying make sure you look closer if that's going to be the reason why. The second cause is going to be tight hip muscles, all right? So tight back muscles, tight hip muscles, muscles that can cause pain all the way down into that glute area. So you're going to start here. A lot of times it will go out to here, and that's a tight piriformis, that's a tight low back, that's a tight muscle basically from here to here. Could also be tightness in the front. As you wind up with those tight muscles, it can start pulling on the hip, it can start compressing the nerves, and that can cause pain that goes into the hip, down the leg, into the knee, so on and so forth. So those are just two of the major causes that can cause hip into that pain. Nerve, which is that herniated disc, or muscle. And again, because this is such a complex structure from your hip to your back, it could be pain that is, or muscles that are tight in your back, in the hip flexor, in your piriformis or your glutes. So it's, again, we're going to show you some stretches that you can do, but you really want to make sure you figure out exactly why that pain is going down the hip, because you don't want it to continue to travel, because that can really lead to some issues. So let's talk about what we can do. So the first thing we're going to talk about, and it's one of my most popular hip stretches, and if you watch any of our videos on YouTube, you'll see this in relationship with the hip, but it's just the figure 4 stretch. You're going to put your ankle on your knee, sit up nice and straight, and lean forward, okay? You're not hunching forward, you are sitting up nice and straight, and you're leaning forward, okay? You want to make sure that you don't bend over like this, all right? That way you're actually herniating your disc when you do that. You should feel a stretch into your hamstring, into your glute, into your hip with that one. You can do that one throughout the day as you're sitting down. It's a really easy one to do without really causing a whole lot of what are you doing kind of questions. The next thing you can do is you can put your hands kind of flat on your back, and then you can push forward. Now, if this causes any pain or any sort of radiating pain, you want to stop immediately. But a lot of times you can get relief in the back from this, and you can also get a little bit of stretch up front. The hip flexors are a little bit tougher to stretch, so this is a little bit more gentler way to do it. Again, but if you get sharp pain or any type of pain, you want to stop doing that immediately. And the last stretch that you can do for any type of hip or low back pain, again, we want to stop if you're going to get, if you feel pain, it's just a hamstring stretch. So you want to start just with your leg propped up on a nice surface. You're straight here, you're straight in your leg. You're going to bend forward nice and easy, okay? You want to, again, hinge at the hips. You don't want to drop down and try and grab your toe. It's really important that you don't do that type of bending motion because you're actually herniating your disc. But those are just 3 stretches that you can do throughout the day to kind of loosen up that hip area. But if you really have that radiating pain from the back down to the hip, maybe even further, it's something you really want to get checked out. You want to find the exact cause of it. You want to make sure that you're not exacerbating it with anything you're doing. If you or someone you know is suffering from back pain or hip pain or radiating pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.